Hello, Assalamu alaikum, and welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Okay, today's topic is going to be about intensive care. We're going to talk about, what the intensive care unit is, who needs intensive care. And, we're trying to give you lots of information regarding that. Now, we are very honoured to have in our studios a guest who's here from abroad, Dr. Mansoor Bangash, who's a consultant for intensive care and anaesthesia. You work at the Queen Elizabeth Hospital in Birmingham. Thank you very much, Dr. Mansoor, for joining us here today.
Thank you. It's a pleasure to be here. Thank you for asking me here.
Thank you. Now, Dr. Mansoor, intensive care, the thought of intensive care usually frightens people because they imagine a unit where there are lots of monitors, machines, tubes, many things going on. Well, who exactly needs intensive care and what exactly does it entail?
Well, that's a very good question. I think that's quite an accurate description as well about what people's thoughts are about intensive care. It's very misunderstood. And that's because, generally speaking, not many of the population come into contact with intensive care. Generally speaking, if you look at who needs intensive care, it tends to fall into a group of two categories of patients, really. One is those patients who are having some sort of major surgery, who need some period of intense observation, maybe 24 or 48 hours, just to make sure that their operation has gone successfully, that they're not having any complications from there. That makes up a very big part of what intensive care does nowadays around the world. They pick up, this would be described as surgical intensive care. They look after the post-operative care of these surgical patients. The other class of patients that come to intensive care, this probably fits the category that most people have in mind if they have any knowledge of intensive care. And these are patients who are medically unstable and are, in fact, at the very severe end of illness severity. And generally speaking, they have some sort of medical illness, which has become a medical emergency, which requires some form of life support. And that's often something that people think of when thinking of intensive care. They think of it as an area where there's life support facilities. And that's correct. But probably a better term than life support facilities, organ support facilities. Because essentially what happens is that when you develop a medical illness which becomes much more severe, at some point one of the organ systems, so for example the heart and the circulation, or on the other hand the kidneys, or on the other hand the liver, one of these, or sometimes one plus another of these organ systems fails.
Right.
So in the case of the heart and the circulation, what that would mean is that the blood pressure becomes abnormally low. And under these circumstances, it becomes very difficult to provide a normal level of blood pressure outside of a specialized unit where there are specialized drugs, specialized machines to support, for example, the failing kidney, or specialized therapies that are required, for example, in the case of the failing liver. Okay. These therapies cannot really be delivered on a normal ward. Okay. And I think over a period of several decades, we've come to realize that most of these patients, although they may come from very, very different ends of the medical spectrum, some of them may be obstetric patients who've had complications, some of them may be medical patients who've developed new onset kidney failure, some of them may be patients who've had massive heart attacks and their circulation isn't working. Although they come from very different parts of the medical world, they're all served best by coming to this area where these specialized therapies and drugs can be delivered. Right. And that, I think, is probably a reasonable definition of what intensive care involves and who needs to come forward.
And who needs it, okay. Yeah. So one thing we discussed as well, before we were recording the program, is sepsis. Yeah. Many people do not know, what that is. Could you please explain that to us? And also, what are the symptoms? And is it something that is a complication that can arise in the ICU, or is it something that can happen in another scenario as well? Can you just educate us about that?
So I think that's, again, absolutely correct. Many people don't know what sepsis is. It's basically a life-threatening condition. It's the end result of the body's abnormal reaction to an infective process. Okay. So you cannot have sepsis without an infection. So that's the key thing. It's something to do with infection. Right. And it's when the infection gets particularly severe and the body's reaction to it is overwhelming, and it tends to start to cause damage to the body itself. I think the reason why people don't know about it is because sepsis is what we would describe as a syndrome in a sense. It's kind of a constellation of symptoms. And again, because infection can affect anybody, people tend to think that they've, if you look at many cancer deaths, for example, they tend to result actually as a result of sepsis.
I see. So who's at higher risk then? The very young, the elderly, or the immunity
Absolutely, yes. So the young and the old, so the extremes of age, they are at risk, and that's because the immune system, which fights infection, is not as well developed in very early age, and it becomes a bit sluggish in later age. These people are particularly prone to developing infections. If you have some other problem with your immune system, so for example, if you've had some sort of transplant and you're on immunosuppressive therapies to make sure that your body doesn't reject the organ, then infection can find a niche in your body and spread much more easily compared to somebody who hasn't had a transplant. And similarly, these medicines are used for a whole host of other conditions. So, for example, one of the big problems that people have is, particularly as they get older, is they start to develop problems with their bones. And some of the bony conditions like rheumatoid arthritis and some of the other similar conditions to rheumatoid arthritis also use these drugs. So again, there's a whole host of people with conditions that require some sort of immunotherapy or immunosuppressive therapy are susceptible to these. And then even outside of that, there are some other factors which are very important for weakening the immune system. So diabetes is an extremely common disease around the world, but oddly enough, diabetes is something which increases your chance of developing a very severe infection.
That's why the wound care is emphasised in a diabetic person.
Absolutely. So diabetics can naturally, as part of their disease process, develop wounds on their legs, for example, because they don't have good feeling in their legs, so they may step on a nail and develop a wound there, or they may develop some sort of ulcers on their legs. Those ulcers don't tend to heal so well, and they tend to get infected. But similarly, you can take a well-controlled diabetic patient, take them for surgery, and their risk of developing a wound infection will be much higher than that of somebody without diabetes. So diabetes is there, and then of course something which is extremely important in Pakistan is the nutritional state of the human. So there's a big problem with malnutrition here, and malnutrition we know makes people's immune systems weak and makes them much more susceptible to infection and sepsis.
True. So what are the symptoms?
So the symptoms are essentially, we can boil them down to severe temperature, shivering, pain in the joints. If you have very fast breathing, that can often be a sign that there's a medical problem there. Other than that, skin rashes, mottling of the skin, where the skin starts to turn sort of bluish, and particularly the distal your fingers and your toes, they may start to turn bluish. These are because of the underlying changes that are happening in the circulation and the tissues, but that's how they manifest, and this is also somewhat to do with the immune reaction. So the reason why we get the temperature is because that's our body's way of, yes, exactly. Other aspects as well are kidneys may shut down during sepsis. So, for example,
is that when it starts getting worse?
Yes, absolutely. So if you stop passing urine, for example, or in the case you may have a child who suddenly stops producing wet nappies, that can often be a sign that the infection is becoming very severe.
That's a very important point. You see, Dr. Mansoor has given a very important point there. That if you have a child, would they be running a fever at that time?
So
or
again,
is that not necessary?
Yeah, usually they will have a fever, but it's not absolutely necessary. And this is one of the reasons why it's so difficult to pick up sepsis, because we can give you a whole list of symptoms, but they don't all classically happen together.
Exactly.
And the other problem is that very many of these symptoms, they're also present in other conditions. So for example, if my son, he has a simple cold, he'll probably have a fever for a couple of days. But that doesn't mean he has sepsis. But I think if you have a child who develops a fever and they start developing other problems, like, for example, if they're in nappies, they stop producing wet nappies. If they start becoming a little bit listless, or if they're an adult, they start becoming severely confused. These are often signs that there's something underlying.
Okay, and this is just not a
it's
normal
getting
infection.
worse. Yeah.
Okay, so those are the signs that Dr. Mansoor has given us. You know, really important. Next thing should be to what? Go to the emergency, go to a doctor. What should a person do then?
Yeah, absolutely. So I think one of the key things with sepsis treatment is early recognition and early treatment with appropriate therapy. And what that means is that as soon as you get any of these signs and the patient starts to look ill, I suppose the other very important thing that can be picked up easily is a low blood pressure or a very thready and fast pulse.
Okay.
So if you start to get these things, really you need to get the person to medical attention urgently. And there, the job of the medical personnel is to identify, is this really sepsis or is this something which is looking very similar to it? Okay. But presuming that they have identified it as sepsis, then the earlier that they can get in broad spectrum antibiotics, the more likely it is that that sepsis will be controlled and
it
will
won't
not
deteriorate.
Yeah, exactly.
Okay. So is there a blood test for that, or how is it diagnosed?
So unfortunately there are no brilliant blood tests for sepsis, but there are a whole host of blood tests that we will take that will help us diagnose, maybe not immediately but certainly later on. So one of the key things that we do when patients come to us with suspected sepsis is to take a set of blood cultures. And what that is essentially taking maybe 10 millilitres, so, you know, tablespoon worth, 20 millilitres, 2 tablespoon worth of blood, putting them into special bottles and sending them to a laboratory where we can wait and see are there any bacteria growing in these, in that sample of blood. Okay. That helps us later on direct our antibiotic therapy much better for those patients. And it sometimes throws up some odd organisms that maybe we haven't covered initially. Okay. So that's a very important blood test. As far as other diagnostic blood tests are concerned, it's quite routine to do what's called a full blood count, where we have a look at the different sorts of cells that float in the circulation. And it's quite common to see an increase in the white blood cells, which are the cells that fight infection. But again, unfortunately, that's not something that's universal. So again, people who are immunosuppressed, if you do that blood test on them, they often won't show a white cell response because their immune system has been dampened down. Right. And again, malnourished patients may not show that response either. So that's why there's no one particular blood test which is just great at showing it.
It's all of them working together. That
so
will
I
give
think
you a
absolutely, it's probably 3 or 4 blood tests plus the clinical picture that will
give a diagnosis.
Exactly.
Right. Okay. So now, tell us also about the dangers of antibiotics, because when we're living in Pakistan and you're talking about the climate here and the general mindset of the public and the patients, it seems that people are happy to take an antibiotic, even if they may not need one, and it seems that they're prescribed very freely, and frequently by doctors as well. Tell us about the dangers of using too many antibiotics. Yeah,
well, so that's absolutely correct. It is a very common practice here to give out antibiotics, and I think there's probably a certain element of that is demand from patients as well. It's a very serious problem, not just for the individual who receives the antibiotics unnecessarily, because these drugs, just like all drugs, they can have side effects, and you may suffer the side effects as a consequence of needlessly taking the drugs. But probably a bigger problem than that is this pattern around the globe, really, because although it's much worse here in Pakistan probably than in England, it's still a problem in England as well. Yeah. So as I mentioned to you, some of the symptoms of sepsis, they occur in other simple conditions like a cold. Now, a cold is caused by a virus. It's normally 2 or 3 days long in terms of its duration. It's self-limiting. Patients get better irrespective of whether they get antibiotics or not. But the problem is that if you get a fever with it, everybody worries that my child is going to be severely ill, and so they rush to the doctor, and there's a pressure from the patients to ask for antibiotics, and there's a pressure on the doctor to give the antibiotic as well. Now, why does that cause a problem? Well, first of all, if you haven't had a bacterial infection, cold is not one of those, you don't need the drugs. You may get side effects from those. Those side effects may range from rashes, diarrhea, or you know, a very rare but anaphylactic reaction, you know, which can be life-threatening as well. That's a life-threatening reaction to the drug. The other problem that we get from there is bacteria are in competition with us and each other to survive. And when we give them these medicines, what happens is that we throw a challenge to them. And what they try to do is they try and overcome the challenge. And the way they overcome the challenge of antibiotics is that they become resistant to them. So they have different chemical ways of getting around the antibiotic. Now, the other big problem with that is that once they learn how to overcome the antibiotic, they can spread that information to the other bacteria, which means that if I give an antibiotic to a patient and that patient develops resistance to that bacteria, the patient's bacteria develop resistance to it, that spread of resistance can go to other bacteria, which means that next time when you actually have a patient who needs the antibiotic, they may have a bacteria that is already resistant to that very good antibiotic.
And there lies the danger.
There lies the danger, because then you have a patient who has a severe infection possibly, who needs the antibiotic early, and what you've done is you've given them something that has no effect on them.
Right.
And this is a massive problem. Even in the early days, very shortly after discovering penicillin, doctors were critically aware that this was a possibility, that bacteria could become resistant to the antibiotics, and that you know, that would leave us again struggling against this massive medical challenge.
Exactly. So, you know, some of the things that you're emphasising upon and you're talking about is, you know, the immune system as well. So, for a person who generally doesn't have many health complications, how can we work to make sure that we have a better functioning immune system? How can we help it?
So I think the best way of maintaining a good immune system is to maintain good health. And the two seem to be very closely linked to one another. I don't think the scientific community has fully sort of understood the mechanism of the link, but what we do know is that healthy people tend to have healthy immune systems. So how do you stay healthy? Well, to remain healthy, you need to maintain a good level of activity, what many people would describe as exercise. You need to maintain a good diet, so something which is not rich in the sort of junk food type stuff that we have here. Yeah, exactly, saturated fats, and you know, very high levels of sugar in your diet. So, you know, probably the classic, you know, you can just take a car ride outside in Islamabad, you can see all sorts of fast food joints.
Oh, yes, definitely, and they're very popular, hugely popular.
Exactly, and you know, as a treat it's probably okay, but if you're eating out there regularly, that's probably something that you need to limit.
How much would be regularly? What?
Well, I couldn't give you a figure on it because I'm not a nutritionist, but you know, I would have thought that you should be eating most of your meals at home, and that maybe once a week is something that's normal to go out and have a treat, you know. But I think if you're doing it much more regularly than that,
is
then
something that
yeah, exactly. The likelihood is that you're going to be eating foods which have got elements of you know, trans fats and very high levels of sugars, very high levels of salt. All of these very bad for your body. They clog up your circulation. They affect your liver, can cause fatty infiltration of the liver. And slowly and gradually, all of these things have an effect on the immune system as well. Again, the mechanism is not clear why, but we do know that people who have worse circulatory health have worse liver health. They have worse kidney health, and that also tends to fit in with, you know, diabetes and diet. They have much weaker immune systems than other people who maintain a good level of physical activity, a good diet.
Basically, a lot of common sense there as well.
Yeah, absolutely.
True.
Yeah.
Okay, so now let's get back to, you know, the intensive care unit as well, and the care that's being offered there. What about coma? What is a coma, and are there different types of comas, and how are they approached? Yeah,
so coma is it's a sort of state of unconsciousness with lack of response to external stimuli. There are different types of coma. So, for example, there are states such as minimally conscious state, persistent vegetative states. These are all very technical terminologies, but really they are describing patients who have lost the ability to respond in a normal way and are essentially, to all intents and purposes, not communicative with the external world.
Okay. But could they be breathing by their own and sort of like...
That's possible, yes. So coma really is a state where consciousness is affected, but consciousness and the ability to breathe are not necessarily the same thing. So you were asking, are there different sorts of coma, or what do people understand by coma? You know, unfortunately, because of the way things are depicted on the media, people talk about medically induced comas.
Yes.
That's not quite the same thing as coma in the true sense. So coma in the true sense is normally caused by some sort of disease process, which means that even if there weren't any medicines rendering a patient unconscious, they would not be really responsive with their outside or communicative with their outside world. Medically induced coma, I think, is probably something that, you know, as a quick description would be anesthesia, basically giving a drug to make a person unconscious. And when you stop that drug, they will wake up. We tend to use anesthesia, or medically induced coma, if you like. We tend to use that as a therapy in intensive care in order to keep patients comfortable while we initiate some therapies, some organ support therapies.
Okay.
Sometimes also specifically targeted therapies, so as in that medicine, the anesthetic itself, is causing some sort of beneficial effect, and that would generally be for conditions where the brain is affected. So, for example, patients who've had severe trauma, have developed some sort of brain injury. To limit the swelling of the brain, we tend to keep those patients under anesthesia in that sort of medically induced coma, as it were. The other sort of the true coma, which we talk about, which does not rely on drugs and is just is to do with the state of the brain due to disease, that can result from very many different processes. Again, infective is one possible process. So, for example, somebody may have a very severe meningitis, which is an infection of the brain. They may somehow get through that infection, and again, you know, all the rest of the organ systems come back online, so the blood pressure normalizes, the kidneys start working again. But if they've had a very severe brain damage due to the infection of the brain, it can render certain areas of the brain which are important for consciousness, it can render them not functional. And that patient may then lie in their bed, breathing for themselves, but unable to respond to the outside world. So that would be one example of a cause of coma.
Right.
And again, you know, other causes of coma again relate to trauma. So again, brain injury following road traffic collisions, and other sort of neurological problems such as stroke or brain hemorrhage. Again, these patients, as a result of these severe insults to the brain, can end up in what we describe as coma.
Okay, so you're talking about brain injuries, head injuries as well. Or we hear this term a lot, concussion. What exactly is that, and how does a person sort of, what are the symptoms and what should they be doing?
So concussion tends to be, again, an injury to the brain. It tends to be due to a trauma, so a knock to the head.
Can that be anywhere? Could it be at home? I mean, if you
yes, absolutely.
without a fall or something?
Yes, yes.
Okay.
So we commonly see it in England in sporting events, you know, so people playing football, people playing rugby, but essentially it's where a patient receives a blow to the head.
Okay.
And that causes a kind of a jarring of the brain tissue inside the head, which has an effect on the cells inside the brain. That results in the condition that we call concussion. But because it relies on a knock to the head, obviously you don't have to be on a sports field for that to happen. That can happen at home.
Right, yeah.
The circumstances in which it does happen at home are probably going to be unusual, so we don't see it very often in the home. But in some sort of arena where a knock to the head is possible, it's quite common. So sporting events, again, road traffic accidents, because the head is unprotected, it's unrestrained, it's moved by very large accelerating and decelerating forces. That's where we see it. And again, symptoms usually are relatively short-lived, but again may relate to sort of short-term memory loss in the for the first sort of few hours, and mild confusion, poor ability to sleep. So very subtle symptoms sometimes. Yeah.
So after sort of a blow to the head, or you know, a person should get themselves checked out, or should they just wait for symptoms? What should they be doing?
Well, I think if you've had a severe knock to the head, you should seek medical attention. You know, normally at sporting events, for example, there's usually a medic at the side who can check you over. But I think in the case of being involved in a road traffic collision, you know, I think if you've had a severe knock and you're having these symptoms, you should definitely seek medical attention. If you don't have the symptoms, should you necessarily go to a hospital? I think that it's probably sensible to go to a hospital and get checked out. But again, you have to sort of play it by ear. You know, if you have a 5 mile per hour collision, it's unlikely that you need to go. But if you've been involved in something with relatively high speeds, you know, even 30 miles per hour, for example, if the other car's doing 30 miles per hour, that's a combined impact speed of 60 miles per hour. You should probably be going to the hospital to get checked out.
Right. Okay. So now we're talking about, you know, road accidents and trauma that way, and then people ending up in the intensive care unit. What would you like to see that people, you know, especially here in Pakistan, how they can be more preventive when we talk about being safe in the car, and also as pedestrians as well?
Sure. So I think there's probably 2 or 3 things. I think from, you know, the average person going out in their car, or the average pedestrian, there's certain things. So one, I can't overemphasize the benefit of seat belts. And if you're not going to wear a seat belt yourself, I think you must at least have your children's safety at the forefront. You must enforce seat belt safety in your own car for your children and for yourself, you know. That would be a very significant change, because, you know, outside of Islamabad, I've seen very few people wearing seatbelts, and it would
this
be
is something that needs to be introduced as a mindset, as a culture as well.
Absolutely,
isn't it?
yes, I think so. I think the second thing which is related to seatbelts is, again, for child safety in the car, the introduction of baby seats and child seats as well. These are very important introductions for child road safety, because the seat belts that are in place in cars are, of course, they're designed for adults who sit there, and so they're not specially tailored for 6-year-olds and 7-year-olds, and so it's extremely important to be able to get the right equipment in there to be able to protect your child. So I think those would be the easiest aspects, and I suppose the other thing which, from the driver's point of view, is to have some sort of responsibility for the roadworthiness of your own car.
Absolutely.
So, you know, making sure that all aspects of the car are adequate. So, you know, proper lights, make sure that the tyres they've got the treads are proper, the brakes are working properly, and that's something that you probably only need to do once a year, but I imagine it probably doesn't happen as frequently in many areas of Pakistan as it should. From the pedestrian's point of view, I think a general
Again, we're
awareness.
Talking about Pakistan as well,
yes.
You know, where...
So, you know, I think there's probably a lot of things that can come from local government. They can probably make road safety much better signage, improved, you know, differentiation between the road and the pavement. So, for example, railings to make sure that people can't easily migrate onto the road. Things like this are very easy to do,
Every
actually.
little thing helps.
Yeah.
Yeah, true.
But then otherwise, internally, from the pedestrian zone point of view, they have to have some road awareness, you know, and I mean, it's breathtaking to see what some people do on the roads here, and
True.
that has to
Unnecessary risks to
absolutely.
their life.
And you know, I would imagine that the best way of doing that, other than just asking people to be more aware, is to actually systematically introduce it. So again, at the schools, you know, there has to
That's
be
something that can be brought in through education.
people have to be educated
Absolutely
about
true. Okay, Dr. Mansoor, you know, while we're on this subject, I think it's really, really important for you to get a message across, because we see in Pakistan this very, very common instance of where we have, you know, the parents sitting in the front and a baby in the front seat in the mother's lap. Can you just please tell our viewers, you know, how dangerous that is?
Well, it's extremely dangerous. The key thing is that, you know, when you place a child in the front seat with yourself, most people I've seen doing that, they don't wear safety belts themselves. And essentially that means that when you have a collision, the first thing that will hit the dashboard in front of you is not you, it'll be your child, because they're on your lap.
They're actually a shield.
Yeah, exactly. And what will happen is that child will receive the full impact of all the forces in the collision, plus the body weight of the person who's holding them.
Right.
So we may think that we're doing our children a service by holding them, making them enjoy the journey. We may even think that we're able to offer them some sort of protection by restraining them with our arms, but the reality is that once a vehicle hits something, we completely are subservient to the forces in there, and you know, any restraint our arms offer is nothing compared to the forces involved in the collision. So really, children should be restrained by seat belts, and they should preferentially be sat in the back. I think in England there's height and weight limits for when children should be allowed to come into the front seat.
Right.
And really, we need to you know, we need to have that awareness in ourselves to take care of our children when they're on the road.
So true. So that's something that is so important, because we see, you know, when you're watching this happening everywhere, then you sort of, you know, you take it to be normal, but it's really, really not, and it's something that you really, really need to look into. And don't sit in the front seat with your child or a young baby or whatever in your arms. It's something that, you know, you would, because as parents we're looking to their well-being and everything, and so many things happen that you don't actually realise until, you know, God forbid, it's too
absolutely.
late.
I mean, nobody has the intention of going out and harming their children, but I think we're probably blissfully unaware of many of the risks that are around us, and our behaviour is actually contributing to that.
That's absolutely true. Okay, so now let's talk about, you know, the ICU and everything that's going on there. We spoke a bit about blood transfusions as well, and screening. Yeah. So let's talk about that in relevance to Pakistan as well.
Sure. So, I mean, first of all, I would say that blood transfusion, it's you know, absolutely key element of modern healthcare. Safe blood transfusion is. It's something that we very commonly do in intensive care units, because we very often have patients who either through severe medical sickness are anemic, in other words they have low levels of the blood cells that carry the oxygen around, and so they need a blood transfusion, or very commonly they've come from a sort of a surgical or a traumatic sort of background, and they've been bleeding or they are actively bleeding, and so it's a very commonly delivered therapy in the intensive care unit. And of course around all wards in the hospital, it's something that's an extremely important therapy. And so to have a blood transfusion service which is safe and effective and well managed is really absolutely important. And the reason for that is not just because it's commonly used, but because it's so commonly used, if there's a problem with that blood transfusion service, it will very rapidly cause harm. And an example of that is, as you've mentioned, screening. So if we look at the incidence of, for example, hepatitis C, which is a a virus
A
which...
huge disease burden in Pakistan.
Yeah, absolutely.
Yeah.
It's a virus which infects the liver and causes chronic liver disease. It's a massive problem here. And you can look at different papers looking at the prevalence of hepatitis C. But what I found interesting was there were some papers which actually looked at how many of the blood donors that go to blood transfusion service centres, how many of them are infected with hepatitis C. And actually it's quite strikingly high. Now, the way that the blood transfusion service works here is it tends to rely, in those places where it's kind of developed as a blood transfusion service, rather than we need blood for this lady who's bleeding, can a relative provide it? So where it is provided as a systematic service, it tends to be provided to a significant degree by donors who are repeatedly coming and offering blood. So if you are not adequately screening for hepatitis C, what you'll do is you'll probably be storing up quantities of not just blood, but quantities of hepatitis C that you then disseminate to ill patients or patients who acutely need a blood transfusion. And so it becomes a focal point for the spread of a very severe disease with long-term consequences. So if you give somebody hepatitis C from a blood transfusion, they probably won't have any ill effects for the coming several months, but many years down the line, they may well develop cirrhosis of the liver with its attendant medical problems. And hepatitis C is just one example of what we call a blood-borne infection. There are many other infections that can be transmitted through the transfusion of blood. So to have a really good watertight screening system in place for blood donors is extremely important. Now, I'm not entirely sure how watertight that is in Pakistan. In some centres it may be very good. I suspect in many centres it's not so good. But the fact that there are papers which have shown that there are donors who have a very high prevalence of hepatitis C is quite worrying.
Which is very alarming. That's absolutely true. Dr. Mansoor, we had so many things that we were going to talk about. Unfortunately, we've run out of time. So, but you know, thank you so much for being on the show, and everything that you've shared today, I'm sure will be very, very beneficial for our viewers.
Okay, thank you. It's a pleasure to be here.
Likewise. Okay, so we come to the end of today's programme. Certainly was a very, very informative one. Intensive care, what it, you know, why does a person need it, what it entails, all those things, all those myths that we have. And then Dr. Mansoor touched on some very, very important things, you know, because he's working in the intensive care unit and he sees all these things, trauma, road accidents, how we can be more efficient in preventive behaviour, because I think that's something that we really need to work on. And okay, so we'll see you next week. Stay happy, stay healthy. Bye-bye.